The home village of Inalahan. Man, my people were reaching out to me over the weekend. I didn't get it at first. One of my cousins messaged me. She said, "Hey, come down to McCrouts and we'll split $1,000."
What?
Yeah, I was like, "What? What is she talking about?" I didn't really get it, but that's because there's like a reward, right? There's a reward when you turn in people who are violating the.
Is there?
That's what I heard.
Is this from what, the Division of Environmental Health?
It's something
or
that was out
COVID?
somewhere, so I saw it somewhere. So I didn't really get it, and then other people from Malolo started calling, and they're like, "Hey, man, what's the limit on this and that and that?" And then early Sunday morning, we saw the video drop. I think someone screened. There was a video drop. I mean, I thought this was an old video because it was just pretty crazy. But I went and I did my research yesterday, which it basically involved going to check my party and then run.
And he's got it up now.
Right, and we have the video up now, guys. Mary, we got you. You can. I don't know if you saw this already, but we'll get you a comment on the video. So when I drove by McCrouts yesterday, and I know Lutz, I know everyone who works down there. It's a great bunch of people. But when I went by there yesterday, I did see the public health vehicle outside. Some people had told me that the police had been called Saturday night. We haven't really been able to get any real confirmation. I did reach out to Public Health Director Art San Augustine and ask him for a comment. However, I didn't get one yet. And so, yeah, there's just a bunch of things with this video. What is allowed, what is not. As you can see, doesn't really look like there's a lot of mask wearing going on. There's even live music, which it's not against that's not against any of the COVID-19 protocols. Yeah, so people were telling me like the cars, it was just crazy. There's no way that was 25% capacity. And the people in the village were talking about it. Maybe I want to try and get the mayor, but I know she's got a meeting this morning. That being said, let's go ahead and bring Mary Rhodes of the Guam Hotel and Restaurant Association on here. Mary, just quick reaction to this video.
Did you?
Hey, good morning.
Good morning, by the way.
Hi, good morning. I actually spoke to the media where that article was. It actually wasn't an article talking about the reward money. That was really more of an editorial piece where somebody was recommending
I see.
How we should go about this. So we all know there's a public nuisance law, and that goes into effect. And I think all the executive orders were in there. But some people are recommending that there be additional fines for people who are hosting the parties or gatherings, as well as any additional fines. So, none of that is in effect. Really, the public nuisance is in effect. And I do know that public health has been giving out citations for gatherings.
What did you think of the video, though? Did anything there strike you as odd?
Well, outdoor, there's a bit of a confusion in the dining. I'm sorry, all other businesses are at 25%, correct? Except for indoor dining and other establishments that weren't approved as of yet. But outdoor dining is actually not is limited. You still have to have the safety protocols and all of that in place. I didn't see the rest of the video. I saw it really quick. And all I can say is that GHRA has been working with public health the last almost 4 weeks to get people to submit their reopening guideline plans. And that's really what I want to focus on today is we have only 6.6% of the businesses who are filed at Rev Tax who actually have submitted their plans, a little over 200 companies. And although companies might already have their reopening guidelines, you still have to submit it to public health. GHRA is offering that assistance to our members and to help people who are interested in finding more about GHRA. But the goal is really to get businesses and establishments to submit their plans. But in doing so, you need to understand your operational guidelines and how you're going to proceed should you reopen, but also have any case, such as disinfection procedures, also crisis communications, both internally to your employees as well as your vendors, and then externally to your guests and to the media. We're encouraging businesses, of course, to inform the public as long as they are following all protocols and disinfecting. I know that KUAM and other media, they did really focus on that last week. And so that's why I wanted to come onto KUAM today on Link, because I think it's really important that everybody do their part. We're all asking to, of course, work together, but we're also asking the governor to reopen all establishments, at least at 25% in PCOR 1. Outdoor dining is not limited to that number, though, because it's limited by number of seats that you have and space available. Some establishments have been approved by public health to expand their outdoor dining, but you still have to make that appointment with public health to approve it, because you have your sanitary permit, you have health certifications. If you're serving alcohol, the ABC license board needs to approve where you are distributing that alcohol. So if your on-premise license is only within your own establishment, you need to ensure that you have areas blocked off or cordoned off that's identified as part of your establishment, so that you are not serving alcohol outside of your premise. So those are really key things, and we can help businesses kind of navigate through that, but also assist you with the government agencies, because we have so much experience in getting documentation in place, the reporting in place, but also the relationships. A lot of people are too afraid to contact the agencies themselves because they think they're going to get additional citations or at least a review. But I do have to put the caveat out there. When public health looks at your reopening guidelines and they do inspections, we share the inspection checklist with our members, and they are also looking for important things like the Guam Food Code. So you have to be in compliance. You have to be compliant with all of the laws on the books, not just for COVID-related issues.
Can you clarify the reopening plans? Are they supposed to be submitted before they reopen? Because
they should. If they're not, what public health does is they ask you for a copy of it. And then if you don't have one, they give you 48 hours to produce one and submit one.
But at the end of the day, I mean, what happens if they don't submit one altogether? I mean, they just
Then they're
shut
given
down?
notices, applications, they are supposed to close down. Those are the ones that they did down during the first shutdown, where businesses where they conducted more than, I believe, 1,500 inspections, and they did shut down a lot of businesses because they did not have the plans. The top 3 violations were not having a plan, not having signage at the front of the door as well as at the cashier area, and not having masks in between eating.
So is this just a one-time deal for the reopening plans? Or when the government shuts down businesses again, do they have to submit another reopening plan? Or is it just one and done type of thing?
It's about, no, once you submit your plan, it's a one-time thing only. But it's not about just having a plan. You have to be able to maintain it, sustain operations with the plan in place. So you have to be able to execute it and have sustainability. So it's not about, again, just submitting the plan. You have to practice it every day. At some point right now, people are so excited to just go out and do things. But I would think that the consumer is being a little bit, they're practicing some discretionary. If you see things that aren't being done right, some people are reporting it. There is a hotline, right, for those kinds of reports. But you would think that some consumers aren't going to patron those establishments because they're not following the guidelines. They rather go to establishments that are practicing the safe measures. But there are some people who don't look out for those things. And, we really can't say one or the other. What we can do is help businesses meet the guidelines, be compliant, assist with any questions, and really get them to do the right thing.
Right, Mary. So why is it that we're seeing such a low number of businesses do what they need to do in terms of submitting these reopening plans to public health?
We've had some things with our food and beverage committee, and I've talked to a lot of business owners. I think you guys have covered several times about just communication, right? Where that's been a challenge. And I think that businesses have really been confused between going opening and closing and how many times do you have to resubmit. If you actually look at the public health website, you have to look at both PCOR 2 and PCOR 3 listings in order to find establishments plans. So there isn't one area plans. It really shouldn't matter on PCOR 1, 2, or 3. They should have one area just for plans and maybe different kinds of criteria between PCOR 1 through 3 or 4. That, you know, as long as the occupancy levels are increased, maybe restrictions are eased a little bit, then those should vary between PCOR. But once you reopen, you should really only submit one plan, but you need to allow your plan flexibility between each PCOR level.
So lack of communication, basically.
Well, it's been confusing for a lot of businesses, lack of communication, even on public health side. But, you know, we work really well with DEH, and DEH has been challenged because they're not in charge of making those decisions. And so what they're trying to do, they did a really good job during the first shutdown to go out and get businesses ready to reopen. I don't know how many that they visited since the reopening of PCOR 1 with limited for curbside service, takeout, and outdoor dining. You know, and again, this is not limited to just restaurants and hotels. This is retail, every other establishment that requires public health overall oversight. And so businesses have to be prepared. They have to not just, you know, submit the plan and again, just do the right thing. They have to be able to practice this every day, especially now gyms are open, churches, you know, grocery stores have been open the whole time, hotels. And so those establishments have been visited several times by public health with regards to hotels and even restaurants. So I think they're going to eventually make their rounds to all other establishments, especially like mom and pop stores. They have to rotate between those kinds of visits, but they've also added inspectors to their team. And the reopening guidelines is not limited to just reopening plans. You have to have the SOPs. You have to have a disinfection plan. You need to be able to explain your communications. And then also, should you have any positive cases or potential suspected cases, what your protocols are when contacting public health, and then your disinfection and contact tracing to test your employees and to report it if you choose to report it.
So do businesses that never closed down during this whole period, during this pandemic, like for example, grocery stores, do they have to submit a reopening plan? Even though they were never? Okay.
No. Hotels, grocery stores, you know, they don't because they didn't have to reopen.
Right.
But in the case of like a hotel, you have restaurants who have been shut down, spas, you know, retail, as well as fitness centers, the pool. So each of those subsections within a hotel, you'd have to submit a plan whenever you have to open up particular outlets within your hotel.
The interesting thing, right? I was just going to just say though, you know, public health, their inspectors, they've had a hard enough time trying to keep up with inspections for their regular sanitary inspections. Add this to their plate, I'm not even sure how they're going to keep up with COVID inspections without, hiring inspectors.
Right. Right now they're at 22. Our last meeting was a virtual meeting with public health, and we were able to have DEH on there. And right now they have 22 inspectors. They were able to increase. They had 10 before. So they're budgeted actually up to 50. And so they are planning to fill in those positions. Some of those are funded through CARES Act, but also a specific grant that DPHSS was able to get. And so they are planning to fill in those positions as well as like the contact tracers that your previous speaker spoke about. So they are really working towards filling in those positions because as we all been saying, you know, COVID is not going to go away. People have to learn to live through this, manage through it, and be able to revive ourselves, revive not just our own communities and families, but even our economy. And so public health needs the support just as much as GMH and all the frontliners. The government, that was the whole point of CARES Act. And with HEROES Act, I'm really hoping that that still goes through, regardless of what President Trump has put out. I'm hoping that, he changes his mind and we really do get HEROES Act through, because it's much bigger than CARES Act. And we really need that funding, because the funding for HEROES Act also had a restaurant stimulus package in it. And then also things like rent relief and some other programs that are really going to help everybody. It's such a much more comprehensive program. And I'm trying to identify areas where we can work with the governor and their government agencies so that we can make sure that it really goes towards COVID related programs, but it does the job of not just taking care of the government, it also does so much for the community and the business community.
All right, thanks, Mary.
Anything in closing, Mary, besides, hey, businesses, get your plans together?
Yeah, we really need to get that. If we keep pushing to reopen, and the Gov made her decision last week not to open up for PCOR 1 to more businesses, including indoor dining, which to me, of course, we all disagree. It doesn't make sense when you're having gymnasiums, churches, and all those other things open up. Indoor dining should be opened. But we also need everybody to be in compliance and submit that, because we're just hoping, we're really trying to do as much to get those numbers down. The government is doing so much to get those numbers down at GMH and with the community contact, but we need to be able, if we can't get that down, and I know everybody's talking about how it's not really making that much of a difference with infections, then we need to be able to get people out in the community and help drive this economy, but still maintain safety and health. It has to be a balance. It really has to be a balance. And so the governor really wants to do that, but the numbers haven't been great. And also, as you heard earlier, there are some special interest groups that we really need to focus on. And once I think they get those things going, we can really look at additional programs we can put out, but we need to fix those things first. But we're really pushing for indoor dining. There's one big difference in the community when you have indoor dining versus public gatherings. Indoor dining requires for your temperature to be taken, a mask to be worn, social distancing be required. In a public gathering, or if you just kind of wait for other things to happen, that there are no protocols, there are no safety measures. Inside restaurants, inside establishments, you can control those measures. And that's why it's probably safer if we can allow those businesses to open, because we are responsible for that to the government and to our community. And so we're really asking for that cooperation so that we can get people back to work. People are getting, a little very restless out there. And I just think that we can do so much by controlling our environment when people go to work. They just have to be able to control their environment when they go home and they interact with people outside of work.
Thank you, Mary.
Thanks, you guys.
Let us know when you want to
Stay
come on
safe.
again. Yeah.
Chris,
Wash your hands,
Jason.
Mary. No, you wash your hands. Wash your feet.
Hey, I have to say, we all do a good job washing your hands. None of us have COVID, thank God. And I just really hope everybody takes it to heart. You guys are doing a good job. And thank you so much for everything.
All right, take care, Mary. Stay safe. Talk
Thank
again
you.
soon.
Thank you. You just made me knock on wood really hard. Mm-hmm. See you, Mary. Take it easy. Hey, grab a virtual Bucci Bucci on your way out. Brie made virtual Bucci Bucci. It's a good recipe, Brie.
I know. It's the bomb.
It is. It's so light and airy. Yeah, we're going to go to Lillian Posadas here. Calling an audible. We're bringing